Vaginal dilators can be useful in several different conditions. For example, if there are vaginal adhesions after surgery or radiotherapy, it can be used for vaginismus or spasm of the pelvic floor muscles, which leads to painful sex. It can be used for vulval skin conditions, or it can be used for conditions like Rokitansky syndrome or complete androgen insensitivity syndrome, where the vagina is poorly formed or not formed at all. So I'm going to show what vaginal dilators look like and explain how they're used. So this is a pack of dilators. It comes in a case, and when you open the dilators, the first one acts as a case for the others, and dilators are plastic shapes of different sizes, graduated sizes from the smallest size to larger and the larger size. In this instance, the dilators screw into each other so that you assemble like this, and this dilator becomes the handle for the smallest dilator. It's important to use lubrication or gel on the dilators before use, and the idea is to use the dilators to gradually stretch the vagina. Often it's helpful to maybe at the start use them during or after a bath, because the tissues, the skin is more supple at this time, so that they can be a bit stretchier and easier to get going with. And the idea is to insert the dilators starting from the smallest size to gradually stretch the vagina, the length and width of the vagina. When this dilator is comfortable, then turn it round, and then you're on to the larger size dilator. And you do the same thing. The recommendations of how long and how often dilation is done varies. It depends on the individual and it depends on the condition. So I'd advise you to just follow the advice of your healthcare practitioner. Once you're finished with that size, you're onto the larger size, which again screws into this one. This becomes the handle, and then that dilator is used to gradually increase the length and the width of the vagina. And usually the outcome we're looking for is comfortable intercourse. So we class a normal length vagina to be about 6 to 7 centimeters in length. The good news is that in most cases, once the vagina has been stretched to the appropriate length, then that length is maintained by sexual intercourse if the patient is sexually active. And generally, you don't need to dilate after that. However, particularly in congenital issues like absence of the vagina, it's important that if you're not sexually active, then you have to keep dilating regularly, not as regularly as at the start when you were stretching the vagina in the first place, but regularly, because if there's no intercourse and there's no dilation, the vagina shrinks right back down to its original size. So you have to start all over again. The things that are predictive of success with dilation are motivation. So it's got to be something that you need to do, that you understand what you're doing, and that you're going to do it regularly. The things that are barriers are sometimes some girls are embarrassed about having to do this. So sometimes there's a bit of a psychological barrier that needs to be conquered before successful dilation is possible. However, the good news is that in the vast majority of cases, vaginal dilation is very successful in treating these conditions. Have you tried vaginal dilation? Have you had issues? It's really important that you've got support. And there are nurse specialists who have an interest in dilation, and they're amazing. And the support from a specialist nurse can be really, really transformational in terms of how likely it is to be successful. The complications, so there is a small risk that you can dilate in the wrong place. So the urethra, which is a tiny little hole through which, a tiny little pipe through which urine comes out that is very close to the vaginal opening. And it is not impossible that the smallest dilator maybe can be pushed into the urethra and into the bladder. So that is one reason why it's really important that you have adequate support, and that support involves showing you exactly where you're dilating and how to dilate. The other is sometimes you can have a bit of bleeding with dilation, which isn't usually a problem, and sometimes it can be a bit painful. So what you're trying to do is stretch the skin, and stretching anything in the human body can be painful. We're not looking for intense pain, but there is a little bit of pain involved. So we're looking for pressure, but just a small amount of pressure won't do the job. It involves pretty strong pressure, which bordering on a little bit of pain. You can take painkillers if you need to. Again, if you're having bleeding that you're worried about, if you're having pain that you're worried about, I would advise that you contact your healthcare professional to be reviewed to determine if this is an issue or if this is just part of the course and part and parcel of the dilation process. So I hope you found this video useful, and I hope it encourages women or girls who need to dilate or who would benefit from dilation. It encourages them to understand the procedure better and to have a go. Good luck and see you soon.